Welcome. Today, we're tackling a deeply important, highly emotional topic in senior care: preserving dignity and urinary rhythm, going way beyond just the diaper. Picture this for a second. It's a quiet Saturday morning. An adult daughter walks right into her mother's memory care room for her weekly visit. But as she steps inside, she notices something new sitting there near the closet: a package of adult diapers. And her face just changes. It's not anger. It's a really profound sadness. We're going to explore exactly why that specific moment matters so much and how we can look beyond that diaper to actually preserve the dignity of the older adults in our lives.
Okay, let's dive into this. Because for families, seeing that package for the first time is rarely just some simple update to a care plan. No, it is a massive emotional milestone. When an adult child visits and suddenly learns their parent is now in overnight diapers, they are processing something so much larger than just supply management. Right then and there, they are forced to confront this really painful distance between who their parent has always been and the increasing vulnerability they are now seeing with their own two eyes. There's this profound insight I want to share with you. Adult diapers are not just a supply cost. They are a dignity signal. Think about that. Every senior care community in the world tracks supply costs, right? They know down to the penny how much they spend on boxes of briefs. But what is tracked far less often is that exact critical moment when diaper use shifts from being a perfectly reasonable last resort layer of support to the absolute default everyday strategy. Because while a facility can easily invoice the cost of a diaper, the cost to a resident's dignity when dependence becomes that early default, there's absolutely no invoice for that.
And this brilliantly illustrates the real scope of the issue. On one hand, you have the visible artifact, the physical diaper itself. But then on the other hand, you have this massive, completely hidden operational and emotional burden that surrounds it. We're talking endless staff time, skincare routines, mountains of extra laundry, odor control, and infection prevention. It creates an incredible amount of stress for the night shift staff and requires constant, delicate communication with families. The diaper is literally just the tip of the iceberg, hiding an overwhelming toll placed on the entire senior care community.
So what's actually driving this transition? Well, a lot of the time it comes down to a very specific number, 3 to 4. For so many older adults, the hidden driver that really begins the pathway toward overnight diapers is nocturia, which is just repeated nighttime bathroom trips. Waking up once a night, sure, that might be manageable. But 3 or 4 trips every single night, that fundamentally changes the entire care picture. Let's really look at what that burden of nocturia entails. First off, it means broken to sleep for the residents, which leaves them totally exhausted the next day. It leads directly to caregiver exhaustion because staff are just constantly on high alert, and it massively escalates fall risks. In fact, getting up to go to the bathroom at night can quickly become the absolute most dangerous moment of the day for an older adult who's still walking. Plus, it causes so much worry for the family. Toileting is one of the most private, fundamental parts of being human. When an older adult is forced to wait for help or use shared spaces for something so deeply personal, their privacy and independence are essentially stripped away. Which brings us to probably the most important question that care teams and families can ask. When diaper dependence starts becoming the default way too early, a community might just be, managing decline. Instead, we really need to pause and ask, can this resident still be supported toward more urinary rhythm, more toileting dignity, and more control? We have got to shift our perspective from simply managing the symptoms of aging to actively protecting the true personhood of the resident for as long as humanly possible. Before we even think about diapers as the default, there are standard practical support layers that absolutely need to be exhausted first. We're talking about things like scheduled toileting, improving bathroom access and lighting, simply adjusting the timing of fluids in the evening, managing constipation, and doing a thorough medication review. These aren't wild, dramatic interventions, but they are absolutely crucial steps that protect a person's dignity. They remind us that the adult diaper should be a compassionate, protective support layer, not just an automatic first answer simply because a system is feeling overwhelmed. Now, what's really interesting about this approach is how we can look at the challenge through a totally different lens. Let's talk about the concept of kidney qi from traditional Chinese medicine, or TCM. In this holistic paradigm, repeated nighttime urination isn't just viewed as some isolated bladder complaint. Instead, it reflects a much deeper pattern connected to aging vitality, urinary rhythm, warmth, and the body's natural ability to hold and regulate its nighttime steadiness. It's really about looking at the root system of the body.
And to support that root system, TCM focuses on very specific vital areas of the body, particularly Shenque, which is also known as CV8. It's essentially the navel area. The true beauty of this approach is that addressing the root pattern of aging vitality and nighttime urinary disruption doesn't require heavy modern clinical interventions. It certainly doesn't require swallowing yet another pill. Instead, it focuses on providing gentle external support directly over this specific navel center to encourage the body's own natural warmth and rhythm. So this brings us to a really unique solution, inspired by this exact TCM approach, 5 Essences Kidney Vitality. This is a 100% natural herbal pouch. It's literally just a flat 4x6-inch cloth pouch filled with recognizable dried herbs, things like ginger, ginseng, jujube, and goji. It is used entirely externally, secured comfortably over that navel area we just talked about with a soft, breathable built. There are 0 synthetic chemicals, absolutely nothing is swallowed, and there is no extra pill burden added to the resident's day. It is brilliantly simple, completely external, and totally natural. When we introduce options like this, we're really making a distinct, conscious choice in how we provide care. On one side, you have a reactive, supply-focused approach, basically just managing decline by ordering more and more boxes of briefs. But on the other side, you have a dignity-centered, rhythm-focused approach. This is a premium care position, one that actively supports comfort and genuine whole-person care long before diaper dependence ever becomes the absolute default. It's a fundamental shift in the entire philosophy of caregiving. So the crucial point is that when we take the time to support urinary rhythm earlier, the whole person impact is truly remarkable. For the patient, it means much more restful nights, far less embarrassment, and holding on to their toileting independence for a longer period of time. For the family, it massively reduces that crushing feeling of helplessness because they actually see their loved one's dignity being preserved. And for the facility, it completely elevates their standard of care. They aren't just managing backroom supplies anymore. They're actively building a premium care reputation backed by a much more confident, less stressed staff. Now, we always want to be totally clear about the evidence, what we call the honest evidence position. This kidney vitality therapy was developed by Dr. Shenque Wang, MD, PhD. It is solidly backed by observational case series and case reports across related aging care patterns. But let's be real, this is not being presented as some magic miracle cure, and it's definitely not a promise that every single person will completely stop using diapers. Instead, it is a highly practical, external, dignity-centered approach for families and care teams who are actively looking for non-pill support. Before we wrap up, I really want to leave you with a provocative thought. Because the issue here isn't whether adult diapers are inherently good or bad. Honestly, sometimes they are absolutely necessary, protective, and deeply compassionate. No, the real question we must ask ourselves is this. Did we ask the right questions before diapers became the default? Did we actively try to support urinary rhythm early enough? And did we protect our residents' dignity with the exact same care and attention that we use to manage our supply closets? Ultimately, our goal isn't simply just fewer diapers. The true overarching goal is comfort, urinary rhythm, caregiver confidence, whole person care, and above all, dignity. We want to give the patient a real chance to feel more in control for as long as possible. Thank you so much for joining me to explore this incredibly important diapers. The true overarching goal is comfort, urinary rhythm, caregiver confidence, whole person care, and above all, dignity. We want to give the patient a real chance to feel more in control for as long as possible. Thank you so much for joining me to explore this incredibly important topic.